So open reduction done when the above method failed or if any specific indication. Then continuous fraction and the closed reduction is failed, then open reduction method is useful. So indications. Then third is the retention. Once a fractured fragment are reduced and it has to be retained in that position till the fracture unites and otherwise it tend to get displaced due to the action of the muscles, gravity and inherent factors. So retention methods after a close reduction are one that is by plaster of Paris splint. This is the most common splint employed and it could be a slab that is encircle half the limb or a cast that is encircle the whole the limb and the functional brace which permit mobility while the fracture is still under the cast. So retention is very useful when fracture segments are reduced and it has to be retained in that position till the fracture unit. Otherwise, it tend to get displaced due to the action of the muscles, gravity and inherent factors. A retention method after a close reduction are that is plaster of Paris splint is most commonly used. It could be a slab that it is also called as a posterior slab that encircle a half of the limb when there is a fracture of the limb, or a cast which encircle the whole the limb. Cast encircle whole limb, or a functional brace that which permit a mobility while the fracture is still under the cast. The second, that by a continuous traction to overcome the muscle forces after close reduction, the tractions could be skin or skeletal traction and is employed as the fixed balance or combined type of the traction. So by the continuous traction to overcome the muscle forces after close reduction. And the traction could be skin or skeletal traction and is employed as a fixed balance or combined type of the traction. Then last is the use of the functional braces. This can be used after the three weeks once the fracture becomes sticky. Rehabilitation is by the way of physiotherapy and exercises, both active and passive. So rehabilitation is also useful in the case of the fracture by the way of physiotherapy and exercises that is active and passive. Then a fracture management by open reduction. It is the operative management. As mentioned earlier, the open method is indicated once the conservative methods fail and when there are specific indications. These indications could be absolute, relative, or rare as mentioned before. Then the indications are first one is the absolute when failed a close reduction, then displaced that is intra-articular fractures, then type 3 and 4 that is epiphyseal injuries, major avulsion fractures, non-union and replantation of extremities. So fractures management by the open reductions have indications when there is a absolute fracture. That is, when fracture failed close reduction, when there is a displacement of the intraocular fracture, type 3 and 4 epiphyseal injury, major avulsion fractures, non-union, and replantation of the extremity. Then, when there are relative indications like multiple fracture, delayed union, loss of reduction, pathological fracture, for better nursing care, to avoid a prolonged bed rest, and closed method that is ineffective in Galeazzi fracture, Monteglia fracture, femoral neck fracture, etc. So, the questionable indications are neurovascular injury, that is, open fractures, cosmetic region, and economic consideration are come in the questionable indications. Then, the methods of open reduction. After the exposure, the fracture is reduced by direct method, and in the indirect method, the fracture is reduced without exposing by positioning and traction over the fracture tip and skeletal flexion. So there is a tensioner and laminar spreader etc. So this is all about the open reduction. Then the principle of open reduction is that known after Labato, that is principle of open reduction as suggested by a Labato include. Hello, पेश काय झालंय? हॅलो, काय झालंय? आले आले, थांबा थांबा आले. So today we stop lecture as there is some emergency.